It's one of the most common forms of cancer among men. September is Prostate Cancer Awareness Month. But are there things that you can be doing to prevent it, protect your health? We're joined this morning by Health Insider, Dr. Shad Marvasti. Good morning.
Good morning, Emily.
Let's start with how many people prostate cancer impacts.
It's basically the second most common cancer in men after lung cancer. So 1 in 8 men will have prostate cancer at some point in their lives. So it is something that's very common, and we really need to be aware of it.
Now, is there anyone who is at a particularly higher risk than others?
Yeah, so although age is like a key risk factor, people with a family history, and then also we have African American ancestry, it's also a little bit of a higher risk. And then people who have certain diets, studies that have found links between prostate cancer and certain foods, specifically milk and dairy products, have been shown to increase the risk for prostate cancer in men, as well as processed meats.
Prostate cancer is one of the slowest moving cancers, but that doesn't mean it shouldn't be taken seriously. So how do we spot a problem?
The 5-year survival rate, if it's localized and hasn't spread, then it's actually 100%. So if it's localized, you have a 5-year survival rate of 100%. But if it's spread to other parts of the body, that 5-year relative survival rate is 32%. So it's really critical to find it early. And the way we find it early is we do screening tests. And usually screening tests start after the age of 55, or they can start at a younger age if you have a family history of prostate cancer. And so the screening test is the PSA, or the prostate specific antigen, which is a blood test. And if that number goes up significantly, it can be a sign of prostate cancer, in addition to the actual prostate exam, which happens in your doctor's office. Some of the signs and symptoms of prostate cancer may include difficulty with urination, getting up multiple times in the middle of the night to urinate, or just the presence of painless blood in the urine. So any of those kind of things happening. Now, it could be just that your prostate is enlarged and you don't have cancer, but that's when the screening becomes important in those situations.
In addition to screening, you did mention diet as a risk factor. So is there anything that we can be eating to prevent it?
In terms of lowering cancer risk, green tea and hibiscus tea have been associated with lowered risk, also lowered risk of an aggressive form of the prostate cancer. So if you get the cancer, it's likely to be a less aggressive form if you're drinking green tea and hibiscus tea every day. Oats, for example, steel cuts oats have fiber, specifically beta glucans, and this type of fiber has been shown to reduce the risk of a number of different cancers, including prostate cancer. Whole grain rye bread, and specifically, is also another one. Walnuts and other tree nuts, and then cruciferous vegetables like broccoli, Brussels sprouts, cabbage, cauliflower, and then cooked tomatoes, which are high in lycopene. All these can also help to lower the risk.
And even if you're one of the ladies watching, make sure that you're checking in on the men in your life, that they're doing their screenings, that their diet is in check.
Yeah, because prevention is the best treatment, right? Because the treatment for this, like any other cancer, is, surgery, radiation, chemotherapy. There could be some hormonal medications you have to take, and there's all sorts of side effects, right, that can happen with that, from sexual dysfunction to difficulty with urination, and a lot of other things that you want to avoid. So the goal would be to screen early, and then also have a healthy lifestyle, and know those risks in your family history as well, to be proactive about it.
Certainly a family journey anytime someone gets cancer, so it might as well be a family effort to prevent it. Dr. Shad, important conversation. Thank you.
Absolutely. Thank you.